European manager. I work with NHS England's National Experience and Partnerships team. We do a varied amount of work, but one of the main areas of focus for me and for Steve in our roles is unpaid carers. So I'm here today chairing the session on behalf of the unpaid carers workstream. We've got a great session today. I'm going to pass off to colleagues in a moment to introduce themselves. But yeah, we're hearing from Debbie and from Donna who are going to talk to us about the new model of triangle of care. Obviously there's way too many of us, which is positive, to do introductions, but if people do want to introduce themselves in the chat, that would be fantastic. We'll have a little bit of time at the end to have a discussion, which is always a really positive aspect of these sessions. So we'll come to that, and we'll keep an eye on the chat as well and make sure we pull out any questions as the session goes on. So very quickly, before I pass over to Debbie and Donna, I just think I feel really grateful to be able to kind of chair and support this session today. My background is in mental health nursing, and I also have some intermittent care responsibilities for a family member who has a mental health condition. And I think that any opportunity to discuss the kind of vital role that carers play within this space and how we can join up and support them better is something that I'm always really happy to see. So massive thanks for coming along and sharing your work with us. And on that note, I will pass you over to Donna and Debbie. But before I do, Steve, have I missed anything that I'm supposed to say?
No, that's fine.
Because I usually forget to say something important.
That you've covered everything. It's just to say, people, if you can, I've put it in the chat, if you can place yourself on mute, because we'll be recording the session, and it's just to avoid any background noise. And if you've got any questions, please just raise your arm by clicking the hand symbol at the top, or just put your questions in the chat box and we'll be able to pick them up as we go along. Yeah, and that's it.
Wonderful. Thanks, Steve. Over to you, Debbie and Donna. I'll let you introduce yourselves and take the session.
Thank you, Jackie. No, not Jackie, Rachel. I've got Jackie on my brain at the moment.
I'm glad you did that, Debbie. No.
It feels like the same old. Hello, everyone. It's lovely to see you all again. I feel like I've come home today, which is really lovely. I'm with my old NHS England colleagues. They're not old, but they're old friends to me. But you're seeing me with a slightly different hat on today, and I have great pleasure to introduce my partner in crime, my new partner in crime, Mary Patel. Mary and I, for our sins, have taken on the role of joint Triangular Care Programme leads for Carers Trust. For those of you who don't know what the Triangular Care is, it's a quality improvement framework, and it's a formal accreditation programme around providing evidence base for CQC and other accreditation programmes. So I'm really looking forward to sharing that with you today. For those of you who don't know me, I am also a carer like the lovely Rachel, and have been caring since back in the 1980s, when in fact I started caring for someone with a serious mental illness, which I still do today. So really looking forward to taking you through a whistle-stop tour of the Triangular Care, noting that it's not just mental health providers that we have on this call today. So going to be sharing with you some more information about what our plans are. I'm seeing lots of names that are familiar joining the meeting, but can I just give a little shout out to Kim Jacobs from Surrey, who is my old partner, sparring partner down in Surrey Heartlands. Right. Next slide, please, Steve. Okay, so I'm going to assume that the most of you have some working knowledge of the Triangular Care, but very briefly, for anyone on this call who is new to the Triangular Care, it's a therapeutic alliance between service user, patient, whatever your preferred terminology is, staff member, clinician, and the carer. And the idea is that by all three working together, we can promote safety, support recovery, and sustain well-being, not only for the patient, but also for the carer. And more important, we make the job a much nicer place for our members of staff to work in. Thank you. Okay, so I thought it would just be helpful again for people who were less familiar with the Triangle of Care, just to revisit some of the history. Triangle of Care actually came from a carers group and was co-produced by carers back in 2010. And it was produced in line with some mental health trusts, some of them who are on the call today. And as such, it was always planned as a quality improvement process, but it was not formally accredited. So the idea was that you would work towards the standards and self-assess your progress in it. During this period of time between 2010 and 2018, some other versions of the Triangle of Care were produced. There was a Triangle of Care for young carers, for example, and a Triangle of Care for people living with dementia. So there have been different iterations of the Triangle of Care during this period of time. We paused the programme during the pandemic for very obvious reasons. And then in 2021, a review of the Triangle of Care model was established with a working group to look at it and to look at the impact it was having and the outcomes it was achieving. And as a result of that, the Triangle of Care model was transformed. And I'm going to talk to you a little bit about that today. After the pandemic, we appointed a Triangle of Care programme lead, and this is hosted through Carers Trust. And there are regular steering group meetings, there are regional groups, there is now a fees model, which I'll talk a little bit about, and there are big plans to expand into health and social care beyond the mental health original pioneering members. So that's a little bit of a history tour for those who were less familiar. And I'll move on to the next slide now, Steve. Again, just a little reminder for those of you who are less familiar with the 6 standards of the Triangle of Care, which in fairness can be used in any healthcare setting. The first standard is around identifying carers at first contact or as soon as possible. We're always talking about that. That is fundamental to the success of delivering the Triangle of Care. We have to identify carers first. But also the second standard is around care awareness for staff and practitioners. If we don't empower the staff with the skills they need and the knowledge they need to support carers, this is a really important component of delivering the Triangle of Care. And that also ties neatly into the third standard, which is around confidentiality, which is a hot topic. I've just come from Matthew Mackenzie's Triangle of Care community group, and we were talking about confidentiality there in relation to carers. Common sense confidentiality too. So we also know in terms of the next 3 standards that these are core components of delivering the Triangle of Care. So you do need to have defined posts in place, and that might be a carer lead for your organisation, but it almost certainly means carer champion roles in all aspects of your services. We also expect to see a proper carer introduction to the service and relevant information available to carers and a pathway for carers in relation to that. And finally, the 6th standard is what support we provide those carers. So that could be internal to the provider arm. It could be support in terms of involving them in discussions about care plans. It could be providing them with training and skills transfer, but it also means what support we've signposted them to in the community after discharge, so that no carer needs care alone. And those are the 6 standards, and underneath those standards we've produced guidance which gives key evidence bases that we look for your accreditation that are fixed against those standards. Thank you very much, Steve. And moving on to the next slide. So what are the key components for success? Well, we're going to hear from the absolutely wonderful Donna Bradford about this. She will go into a much more detailed presentation than I am here. But for those of you who are looking for what you need to have in place to achieve this accreditation, you must have high level buy-in. And you must have governance. So what we're looking for is senior sponsorship, normally at board level. Chief nurse typically is a common post holder for to hold this portfolio, but there are other examples. But you do need to have senior sponsorship, and then there is a process of self-assessment and evidence against those 6 standards that I've just shared with you. If you're joining the scheme, we'll ask you to self-assess and benchmark where your services are now using RAG codes, red, amber, and green. But if you recall, I said to you that the Triangle Care is a quality improvement framework. So it is not a destination. It's very much a journey. So when you're starting your Triangle Care journey, you may find in your self-assessment that you have some good practice, but you also are using our self-assessment tool able to identify gaps in service. And we expect that. So please don't worry if there are lots of reds and amber. But most of all, and things that we've learnt very much in all of our works, and as carers leads, I'm sure you're very familiar with this, is culture change. We're not looking for tokenism. We're not looking for tick boxes. We are looking for a real commitment to actually work and support carers and recognise and value them. And that's not just in terms of supporting them through a hospitalisation period, but it is actually involving carers and putting them at the heart of everything we do, including carers, that revolutionary thought. And actually, where we look for evidence is in examples of how carers' voice has influenced service design change. Have they been involved in developing and co-producing resources? Because those are all the things that actually lead to culture change. And that leads really nicely into that co-production and engagement work. So as part of the evidence base for Triangle Care, we again look for examples of that. And in fact, when the examples are missed, you may find that Mary and I will revert back to you and say, oh, we're missing a key component here. And we do want to see carers involved in all aspects of the service work and the organisation work. So it can be at many different levels. And there's some great examples out there. And number 5, action planning for continuous improvement. So there is always something to learn. I've been working in care as well for many, many years now, and every day is a school day. There's always something to learn. And actually with our real front runner, trailblazer, innovator sites, and I know a few of you are on this call because I've seen your names pop up. It's really exciting to see how you are taking the lead and continually looking ways for reaching out and innovating around your carers practice. And that's what we want to see. And we also want to spread that best practice. And finally, closing the loop, it's feedback, isn't it? So we need to hear from the carers, from the people using the services, the patient service user, whatever your language you prefer to use. And we also need to hear from staff. And actually, in hearing all that feedback, it's how we then use that feedback to influence and improve our programs of work and our quality improvement journey. So that gives you a very quick whistle-stop tour of the Triangle Care model and what you need to do to implement it within your trust. Thank you, Steve. I've mentioned that we have an accreditation program. So prior to 2022, there was no formal accreditation process. So we have now worked with our friends at CQC to formally develop this process. And I'm just going to quickly whip around this little wheel to try and explain to those who are less familiar with you what that process is. So initially, you would ask to join the Triangle Care scheme. You would put an application form in and we would do our due diligence. There is a membership fee to join the community, the Triangle Care community. And I'll talk to you about fees. I think it's in a slide coming up, but roughly it's about £600 to join the scheme, and that provides you with a membership offer and access to the resources and the regional groups that I've mentioned earlier in this presentation. Once you've joined the scheme, we ask you to do your self-assessment of your organisation and look at evidence that you've got to support your gradings, and then you're asked to submit your self-assessment. Now, we have different ratings, and I'll talk to you about those in the next slide. But at this point, you would come forward to a formal accreditation panel. So this is new, okay? So the formal accreditation panel is made up of myself and Mary at Carers Trust, but it's also made up of provider professionals like Donna, who is going to be talking about her experience with Triangle Care at her trust. But it's also, much more importantly, also includes carers. So we have what we call peer review panel, and they come together and they look at all the evidence that you have submitted, and then you are invited to present to the panel on your work, and there is an opportunity then for questions and answers. As a result of that, you are then either accredited star 1, star 2, star 3, or we come back to you and ask you for any other evidence that we think is important to actually support your bid. And part of that accreditation process will be evidencing that you're working in partnership with your local carer organisations and third sector partners. After that, once you have been accredited, you will produce an annual report to the Carers Trust to demonstrate that you are continually working to improve and develop your carers offer. So some of that will involve demonstrating and evidencing through data. For example, how many carer staff you've trained in carer awareness. It might be how many carers you've identified, but we do look at year-on-year analysis to demonstrate that you are retaining that standard and that you're continuing to innovate. And that tells you a little bit about the sort of membership practicalities, but I know you want to hear a little bit more about the star ratings and the fees. So I'm just going to ask Steve to flip that slide over, and we'll go on to that. So under the old criteria, we and the new criteria, we have 3 stars of accreditation. Okay, so the first star accreditation currently in mental health is for Inpatients and Crisis Centre. The second star is for remaining for your remaining mental health services. So if you're in mental health provision, it will be all other services apart from the ones that you have completed in star 1. And star 3, which is probably going to be relevant for a lot of us in this meeting, is about wider community settings. So this is where you work across acute settings and social care. So some organisations will only work in star 1 and 2, and some will work across all 3. And you will follow an accreditation programme through. The first one is to accredit your inpatient and crisis work. Once you've got that accreditation, you can move on to star 2, which is your remaining, and then the wider settings. It is not bronze, silver and gold. And I had to make this point earlier this morning in terms of that the Triangle of Care is a quality improvement framework. So there will be some people who are very new to Triangle of Care whose quality of carers work will be very different from those who have been doing this work for 15 years. But it is an ongoing process, and that is why we have the annual reporting. Thank you very much, Stephen. So I'm now going to talk a little bit about fees. I do hope that is my next slide. I'm doing this by memory. No, it's not. This actually represents what I was really saying in the other side. So I'm going to move on to the fees quickly, because that really explains the star ratings. So it's just a different representation. Thank you, Steve. Right, so your membership to join the Triangle of Care scheme and to use our branding, which you have seen throughout this presentation slide, is £300. So that's 250 plus VAT. So everything, it has got to include VAT, but as anyone in the NHS knows, you can get that back. So your annual membership fee once you've joined the scheme is £600. Okay, for NHS providers. In the private sector, it's slightly more, and in the third sector, we do have some third sector providers, it's slightly less, recognising resources, proportional resource. Your accreditation, which is where the cost is incurred, is for achieving your star 1, your star 2 and star 3 is for the NHS £2,400. And that cost literally covers the cost of the time of the panel to read through all your submissions, to meet you at panel, and to prepare a report back to you. So it's not Carers Trust making any money. It is literally covering our cost to follow the formal accreditation panel. And that can be the basis for your CQC inspection, but it also, as I say, provides an evidence base for other accreditation programs like AIMS, which I think some of you may use. So that gives you a little bit of an understanding about where the fees model are. They haven't changed since 2022. They may well be subject to review in the future, but we will keep you posted. Thank you very much, Steve. And then looking at what we're currently doing at the moment. So it's been a very busy Q3 and we're now in Q4. We are expecting annual reports from all of those on the right, and that involves Mary and I reckon it's about 8 hours for each report. So reading through all the evidence and looking at opportunities of identifying gaps and putting in touch different other examples of best practice and support. So each one of those will be coming forward. And we've also got a number of accreditations coming forward in these quarters. Really excited to see Livewell Southwest. I don't know if they're on the call today from Plymouth. We've also got Signet and very pleased to see St Andrews Healthcare, which is an independent provider. So quite a different array of accreditations coming forward in Q4. Thank you, Steve. And I think this will probably be of interest to those of you on the call who are outside the mental health landscape at the moment. So currently, Triangular Care has been mainly deployed in mental health settings, but clearly it has utility and efficacy in other settings. So the areas that we are looking to expand our reach and impact in 25-26, we are starting a social care pilot working group. In fact, that's kicking off next week, and we'll be looking to co-produce some social care provider guidance. We are also looking at working very closely, and we already do, with the patient and carer race equality framework. We've got another working group kicking off in February, looking at how we can co-produce some top pre-CREF guidance in 2025-26. I'm really pleased to say a number of you have already been in touch, that some of the big acute trusts have contacted us and are interested in deploying the Triangular Care for their formal accreditation process, and we're going to be starting to work with them. And I know a few of the names on this course, so we'll be looking to pilot that in 25-26 with you. And interestingly, we've also had interest through the ambulance service. I actually met with the London Ambulance Service last week, and that's obviously an area of growth that we're excited to work in. Mary and I are actively involved in the mental health bill, as is Carers Trust, and we're contributing to that. In fact, many of you who know Andy McGowan, he's called for an amendment around young carers. So that's a continual piece of bit of engagement work that we're involved in. And then I wanted to talk to you about what our plans are in terms of the offer. So we recognise that to retain that important heartbeat of the Triangular Care, we need to support our community of practice. And so as part of that, we're going to be starting regular specialist webinars. In fact, the lovely Donna is going to kick that off for us in April, doing her roadshow on confidentiality. So people will be welcome to come and join that and learn from her expert knowledge. She is the guru on this. And we're also looking to expand our website so that there is an opportunity then for providers to direct talk to each other and to also load best practice examples so that other providers can come along and use it as a repository. And finally, we are looking at reviewing all the current paperwork to streamline that, to simplify that, and to standardize it, and also to get your member feedback. But that's enough about what we're doing at Carers Trust to support the Triangle of Care delivery. What I'd love to do now is introduce you to the fabulous Donna Bradford, who will talk you a little bit through, far more interesting than me, on the provider side. Thank you, Donna.
Thanks,
Steve.
Debbie.
I don't know if Steve wants to turn the slide.
Good afternoon, everybody. My name is Donna Bradford. I'm the Quality Improvement and Assurance Lead for the Experience of Care at Lincolnshire Partnership Trust. And I'm just going to talk a little bit about some of the things we implemented by using the Triangle of Care, just to demonstrate the impact of what it can be like for carers. Next slide, please, Steve. So just a tiny bit about our journey. I think you might need to keep on clicking, Steve. We actually joined up to the Triangle of Care in 2015, and at that time we had no real dedicated carer support services at all, apart from a very small carers education group that I used to run on a Thursday evening for a small group of carers, and that was all we really sort of had. And at this time in 2018, I was given the lead for the trust to implement the Triangle of Care. Next slide, please, Steve. So part of the implementation stage was that we would, again, you have to keep on clicking, Steve, sorry. Following the benchmarking tool, we implemented our carers who attended our group to be part of the feedback, and started a Triangle of Care steering group to get their views. And we had regular consultation about what they wanted or what they felt would be useful for new carers coming into service. Obviously, they were already in the service. And they developed a Triangle of Care information pack of what they would have wanted to know when accessing the service. And at the same time, we knew we had a lot of care patients out of area, and they actually did a leaflet as well for out of area carers to know what to ask for. We identified carer leads in all areas of the trust. At the start, it was our crisis teams and inpatient wards, and then obviously in stage 2, it was the community service as well. And they all identify themselves with orange lanyards, so that when carers are going into services, whether it be an outpatient clinic or a ward, that the staff wearing the orange lanyards are the ones that have got the extra training to signpost them to, other services. Can you click again, please, Steve? We gained level 2 accreditation by 2018, and obviously we continued to submit our annual reports to show our progress against the standards. And actually in 2018, I was given a dedicated post just purely to deal with carers and relatives for the trust. During COVID, obviously, it was very different because a lot of the work stopped, as many of you will remember. But we did develop a carers council online with a large group of carers who had lots of experience with the trust, and what they did, we will go into a little bit more. Next slide, please, Steve. So these are just some of the things that are on offer at LPFT. We now have dedicated carer champions, band 4 on the 4 acute wards in our trust, and we also have a rehabilitation one as well. I know a couple of our carer champions are on the call as well listening, as well as our dedicated band 7 clinical lead in our older adult services who purely deal with carer related issues. As I said, we've got a carer lead in every ward and team across the trust, and we have monthly online forums to keep people updated, keep their resources updated, and make sure that they're all, in line with what we're doing. We also train our carers to interview our staff, even at senior level. We have another session this week, actually, where we try and get our carers on every single board that we use for interviews. We also have in-house marriage and family therapy training for frontline staff. We deliver about 5 courses per year. We have over 150 staff now trained to deliver family therapy. And again, I'll talk a little bit more about that in a minute. Next slide, please. So the information pack that our carers actually developed right at the beginning is now sent out to all carers identified on entry into the trust where their loved ones are accessing our services. We continue to do the fortnightly online carers education group. We have over 300 carers on that invite list. We have a dedicated speaker each one. It's not a support group where everyone just chats. So that's what we use our third party organisation for. But this is actually education around services. We have psychiatrists, pharmacists coming along to that so that carers can ask questions and find out more about illnesses and medications. We also have support for our staff carers because, as we know, 1 in 3 NHS staff are a carer themselves. So we also have a lot of support in place for them. And through that, we also have the Carer Confident Accreditation Level 2 through Carers UK as well, that demonstrates that we do actually support our staff carers. Our Carers Council is a big one. Again, I'll talk a little bit more about that in a minute. Next slide, please, Steve. We also have some carer peer support workers within the organisation, and we've now got 4 appointed in the trust in different services. We have 2 in our older adult services and our community rehab team, and our CYP services employ parent carer peer support workers as well. We have, as Debbie mentioned, the confidentiality roadshows, which again was developed by our Carers Council and our information governance team. We do know confidentiality is the biggest issue for carers who are trying to get information about their loved ones. And we've now trained over 400 frontline staff, and it's been made mandatory in our adult inpatient and adult community services now as well. So we will be doing a lot more training this year. We also managed to train a large number of carers in our mental health first aid course so that they could recognise signs and symptoms within their loved ones. We have a dedicated email address, which is monitored by myself and one of my nurses. People can just, carers can just directly go in and ask for information or signposting. And we have a pharmacist and a consultant psychiatrist that sit behind that can answer generic queries as well. We also have a dedicated staff member in our recovery college who his job is to actually deliver and sort of make courses just purely for carers. And again, we'll give you a few examples of what courses are available through our recovery college as well. Next slide, please, Steve. So our Carers Council, this has been a great success in our trust, and we've got about 15 carers currently on it. It's run online monthly. It's on a Monday evening, and the great thing about it is our chief exec and our director of nursing attends, so our carers have direct voice straight into the board. The Carers Council have developed a large number of leaflets on our website for a variety of things that they think may be useful for carers. So it's written by carers for carers so that they understand some of the things that may happen whilst their loved one is in our service. And we give this as an opportunity for carers to truly have their say in at senior level, and we've got that senior buy-in as well. Next slide, please, Steve. What we also do is we have other services come along that might be internal services within a trust, or our ICB will come in to get the carers' views on future documentation, future initiatives, and what the carer view is. So our ICB has been along, and recently we had the community division come in to look at how we make our letters to patients more friendly, so they're not too clinical, they're nice and friendly, and that actually will be more understandable to people. Next slide, please, Steve. These are just some of the leaflets that are on our website. If anyone wants to pop the website address into the chat, I'm happy to do that. We have the Carers Council developed all of these sort of leaflets, and we've just recently put some more on. Things like dealing with deliberate self-harm, bereavement, ambiguous grief, young carers, understanding observations, how to deal with the mental health crisis, advanced statements. So we've got a large number of leaflets, all got printable versions on there, and you can just go onto the website and print those off, or our staff can actually print them off and hand them out to our carers as they go along. Next slide, please, Steve. This has been a successful document again that the Carers Council devised. Often we know that in acute hospitals, patients can fill in documents called About Me or something similar, but we know that some of our patients are unable at the point of entry into our services, too unwell to say what their views and wishes are. So what we've done is made an About My Relative, which can be given directly to the carers to give us the information we may need to truly understand that individual. And it covers physical health problems, mental health problems, triggers, and can really help with, sort of making up the care plans and that personalised approach. And obviously the carers feel that they are now included in the care journey because they're able to give that information that we vitally need as well. Next slide, please. So again, just a few recovery college courses we have. We have compassion fatigue, surviving summer, who is a carer, and we also have a cancer course now, and soon to be coming dual diagnosis and dementia. So our dedicated resource in there, we work closely with them. Plus, we also do an extended carers awareness training for staff through the recovery college as well, which is an extended on our carers awareness training program as well. Next slide, please, Steve. So what's the impact? Because obviously, doing all of this, we need to understand what our carers actually think. And so therefore, these are the 2023, we're just about to do the 2024 surveys, but these are some of the results that we got from our carers survey. So 84% of our carers felt listened to. 74% said that they had been consulted and involved in discussions around their loved one's care. 96% said they were treated with respect by our staff, and 80% described their experiences as very good or good. So that shows us that we're nowhere there, we're not 100%, but we know where we're going, and we're hopefully going in an upward trajectory. Next slide, please, Steve. What we do is we use the carer survey as you said we did. So when we do get comments on it, when we read through them, we try and look at how we can make things better and make things different for carers. And so therefore, things like the Carers Council came from people saying that we weren't listening, and that we looked at the confidentiality roadshow for staff that our Carers Council developed, and I've got a few statistics on that in a moment. Next slide, please, Steve. So we developed the Confidentiality Roadshow, which is an hour-long training session through the Carers Council, and we do a pre and post evaluation about how people feel around sharing information with relatives. So how confident they feel in confidentiality, capacity, consent, and lasting power of attorney. And as you can see there, there's an increase in knowledge in all areas, but particularly around lasting power of attorney. And the evaluation of those 400 staff was that 100% of them found it useful, and they felt more confident in sharing of what they could say rather than what they couldn't. So like I say, we're rolling that out, and I'll be doing it for the Carers Trust as well. Debbie's twisted my arm to do it for them as well on the first webinar. Next slide, please. We are also doing a quality improvement project in our adult community division, where we are offering the increase of family therapy to families in crisis, and hopefully we will be measuring to see if when families are supported, educated and equipped to deal with their mental illness, that the patient is less likely to relapse and be readmitted, because what we know is that people who understand better the techniques, because we know carers are not mental health nurses, so if we can help them to understand the illness, how to deal with things, recognize early triggers, and hopefully we can prevent people from going back into hospital. It's too early to measure it currently, but hopefully in a few months' time we'll be able to see if there's any improvement in that. Next slide, please, Steve. So I suppose just to finish, why join Triangle of Care? Well, we've certainly seen a massive difference in LPFT. We know that carers will remain in the forefront because it's an accreditation programme, it's rolling, it's continual, we need to do an annual report, so therefore it keeps carers in the front of our minds. It is an accreditation that we can demonstrate to CQC, and as with other accreditation schemes, carers is covered across all domains and services when we're doing things like AIMS. we know that carers can be demonstrated through the triangle of care in all of those accreditation programs. And the price for the triangle of care is actually for the whole trust and not divided into the areas that we're looking at. Next slide, please. So this is actually something that one of our carers from the Carers Council did. And this is how he visually explained the triangle of care. He said that right at the beginning, it felt like people were saying, stop, you can't come any further. We're not telling you anything about your relative. And then Triangle of Care came along, and that was the light bulb moment where things started to change. And instead of him not knowing which way to turn, this way or that way, actually the Triangle of Care gave him hope in the fact that things were changing and that we had a better understanding of the carer needs and that things were changing for the better for our carers. Next slide, please. Thank you. And I'm sure me and Debbie will take any questions or comments if you would like to ask any questions.
Sorry, get myself off mute. Thanks so much, Donna, and to Debbie. That was a fantastic presentation. I think always testament to that is the number of questions that they're in the chat in this session. So thank you. Lots of applause and thumbs up there. We've got a question from Caroline. Did you want to come in?
Yes, please. I'm delighted that you're extending it to all care and including social care. I've been actually promoting triangular care as a model whenever I get the chance in whatever forum it is. And I think that's brilliant because it applies to all care services. And you know, it's just well overdue, and I'm really glad you've got out of the just mental health. I mean, it's obviously terribly important there, but that it's extending itself, and I can really justifiably promote it. I mean, I work for Carers UK, but we work in the same direction, and so that's fine. Thank you.
No, thank you, Caroline, and absolutely, we want to do this in partnership very much with other stakeholders. Carers UK, obviously, good friends and busy working with them. But it is very much a journey for us, and for us to work in and expand into other sectors is going to take a little time. It's definitely something we're planning to expand into 25, 26. It is just worth it because I feel my little Mary person sitting on my shoulder, reminding me to say to everyone, Mary and I are the only resource. So we're one full-time equivalent for all of this work. So please bear with us and please help support us, actually, because we need you to contribute to really making the triangle of care accessible for all providers.
Thanks, Debbie. Jonathan, you've got your hands up next.
Yes, hello everyone. I'm Jonathan Wells from Cambridgeshire and Peterborough, Rethink Care Support. Just two very quick things to ask. One, it's been really good learning from Lincolnshire, not only things that you've introduced from the top down, but also finding out whether it actually improves the carer experience. I can't remember if the carer survey that you referred to is mandatory for mental health trusts and annual. So that's just one question. My other question is about the audit that you mentioned, about when families are engaged with, whether that leads to relapse. I would hope somewhere nationally or internationally there might have been research on that already. So I don't know if you've got any more information about that.
Yes, there is. So actually, the Meriden Family Therapy Programme showed that when families were supported and educated, there was actually a 40% reduction in relapse and readmission. So I think just for our own benefit, we're trying to have a look at, our own benefit for delivering that. So our quality improvement work around the adult community team is that actually they are paying staff extra to deliver family therapy outside their hours on bank. So they'll include travel time travel expense and the time spent, so that we can increase the resource to families who potentially need it. And the carer survey, although it's not mandatory, what we do is, because I also manage the volunteer service, we have trained volunteers who will do the follow-up carer survey calls, and then obviously we can then input them into Envoy to pull out some data. So we try to do that every year. Does that answer your question,
Yeah.
Jonathan?
Thanks very much, Donna. We'll try and steal a few of your ideas in Cambridgeshire.
No problem.
Thanks, Jonathan. Oh, thanks, Jonathan. Next on the line for the question is John, but I know it's not John, and I'm so sorry.
It's Dot.
Dot. Thank you,
Yes.
Steve.
Sorry about that. Yes. I am a participation partner and, well, under the duress of carer for my son with Live Well Southwest. And we automatically, at the moment, have managed, well, Live Well covers social care. So we're already working with members of social care around the triangle of care. And we've also got contact with the race equality support service in Plymouth as well. So I think we're doing good work as far as that's concerned. But my passion for many years now, because I've been working with the triangle of care, well, we got our first star. Live Well got its first star in 2016, but I've been working alongside the triangle of care and their organisation since probably 2-3 years before that. So I know sort of what the journey entails and the pits and humps that we have to go through. But my passion for a long time has been trying to introduce the triangle of care into formal teaching in universities for nurses and medics, so that they learn about the principles of the triangle of care in their very early stages, long before they become professionals. So it's almost sort of ground into them from day one. And I think when I was involved in the training of some of the nurses coming through Live Well, what came about as very evident is the fact that obviously they're taught a great deal in a very sort of strong way about confidentiality and the legalities about breaking confidentiality. And we came across this in our training around triangle of care on numerous occasions, with nurses saying, oh, well, you know, we're so afraid of saying or doing the wrong thing because we understand the sort of restrictions that are around that. And that's why I really want to counter that. I'm not saying we shouldn't have confidentiality and legality rules around breaking it, etc., but it needs to be balanced alongside young people learning about the triangle of care at the same time, and the need for that. My second also wish is to have this seen in primary care in GP surgeries, because again, a lot of carers come up against that more so in primary care and GP situations than they do as much in sort of organisational settings. So anybody's strong answers to counter some of that would be very welcome.
Oh no, thank you very much, Dot. And to be honest, we're doing some great work with you guys down in Plymouth, and as you saw, Claire Sterling is coming to panel very, very soon, and I think, Dot, you'll be joining us, so that will be really exciting, and you'll be actually able to go through the experience, which I think will be quite interesting for you. And also your organisation is also going to be one of our pilot sites for social care. So I think that's an exciting development and expansion into a new area. I absolutely hear you're not the first person to talk to me about training and how we embed TOC training and actually carers awareness training into you know, more professional modules, and Carers Trust is really looking very closely at that. So it's something that is in the cards and being considered. And in terms of your point about GP practices, absolutely. I mean, I was around when Dave Ross, co-produced the original GP quality markers, and many of you will recall that work. And actually, the triangle of care standards, 5 of them overlap completely with the GP work, which is actually really a good sign, because it shows that we're covering the same ground, which is really important. And we've met with Jim and Ellie in the NHS England team, and we've sort of shared some thoughts about how the triangle of care might be adapted for primary care. So hopefully that gives you some answers, but there may be other responses from other members on the call.
Thank you, and thank you both, you and Donna, for your presentation today, because it's been really helpful and really good to listen to.
Thank you, Dot.
Thanks, Dot, and thanks, Debbie. We've got a couple more questions, and I'm just mindful of time. So just to point out, Steve's mentioned in the chat that if there's any questions that we've missed, we will make sure that Donna and Debbie get those and hopefully get back with some responses. But it's just great to see that this is obviously something that's provoked such a good discussion. So I'm going to go quickly to Dawn.
Hi, thank you. I'm Dawn Eastham and I work for CNTW as an involvement facilitator. I'm leading on our youth bank, and I guess my question for you ladies is, how do we go about ensuring that the young carer's voice is heard and embedded effectively within our triangle of care? Just any ideas that you might have for how we go about engaging with those young carers?
Oh, Dawn, yes, it's so important, isn't it? I don't know, Dawn, have you actually been to, I mean, I know you do really amazing work at CNWL, and I've just actually done your annual report, which was fantastic, I have to say.
Yes.
But I don't know, you've not put in a submission or self-assessment for the Triangle of Care Young Carers standards. So that is definitely something I would suggest you look to do and to follow through. The other thing is, of course, we've got Young Carers Awareness Day coming up, and not just for you, but everyone on this call. What we'd really love to see everyone do is sign up to Young Carers No Wrong Doors and the Young Carers Covenant. And Steve, I suspect we can stick those links from Carers Trust in the website, but it's a really good opportunity to get those elevated within your governance. And Dawn, this is my offer to you, because young carers are a passion for me too. I'm sure they are for many. I'm very happy to meet with you offline and have a bit of a discussion and explore about things that you might like to consider, and also for us to hear back from you about things that you think might work.
Oh, that would be absolutely amazing. Thank you very much. I'll reach out to you after the call, but that's amazing. Thank you. And if those links have just gone in, that's amazing. I'll make sure I sign up to that. Thank you. And thank you for your presentation. It was really helpful. Thank you.
Dawn, we also do at LPFT is we have our young carers lead from the local authority sit on our carer lead forum. So she comes every month and talks about the young carers referrals, how many referrals they've received, helps anybody out with identifying on the early help assessment. So we found that really useful.
Oh, brilliant. That's great. Thank you for that, Donna. Thank you.
No problem.
Right. Thanks both. So we've got Sally next and then Andy, and then we'll have to just check for time to see whether we've got time for any more. So over to you, Sally.
Yes, hello. Just a point on, I'm with Avon and Wilts, AWP in Wiltshire, and I'm a carer trainer. I've been in the training department for 25 years. And as much as possible, I promote the triangle of care all along the way. And I was involved some years ago in teaching this doctor, just to tell you that teaching is happening in the west of England. Some years ago, I was teaching students at the West of England University, and I was waving the triangle of care. It was very new then, but I was talking about that then. And then more recently, I do annually, every year, we with a service user, we go into Bath University to teach social students, social work students, around working with families, and particularly, obviously, from the mental health point of view. And that's really rewarding work to talk to the students, and you'd be glad to know they have a really healthy intake every year, which is always a wonderful surprise that people still want to go into social work. And just to mention, with the young carers, AWP back in the day made a really lovely video. I don't know if it's still around, or probably in the archive somewhere, on young carers, and it would still be really relevant now. I don't know if it's recoverable, but it was an excellent, with lots of young carers talking about what helped and didn't. Yes, so I wave the triangle of care, the first opportunity, the minute I'm asked to speak anywhere. And it's great. Thank you for your presentation. It's great to know that it's hopefully expanding, I think, particularly to private primary care and the GPs. I think that would be excellent. My daughter's a health visitor, so already I've given triangle of care. Thank you.
Thanks so much. Thanks, Sally. And I've just noticed that Steve's popped the refreshed guidance for supporting young carers in primary care in the chat as well. If anyone's not seen that, might be helpful for people to have a look at. Andy, I think we might have to take last question from you. I'm sorry that the time's run out already. I think we could probably talk about this for another hour or more. Over to you, Andy. I think that you might be on mute, Andy.
Yeah, thank you. Sorry, I'm Andy Scorer. I'm a carer and involved on a voluntary basis, both with the, well, hello, Jane, the Hampshire and Isle of Wight Healthcare NHS Foundation Trust, and also Southampton Carers Partnership Board, which is like the Southampton Local Authority run thing. But that's voluntary, not paid work. And yeah, I suppose a couple of things I wanted to say. First of all, reinforcing something I heard about the Common Sense Confidentiality Roadshow, or about the importance of training people in what they can say. Yeah, that's always struck me, because I've always had a feeling that, if you like, staff are so frightened by the legality stuff that they've missed the obvious thing of what's public information, and and just being able to, well as a more commonly thing said, well, you can listen, can't you? But people do need support, and support can be given, and helping people understand what they can do is one way of helping them not get so caught up in what they can't do. But the other thing I was just striking me as you're kind of expanding the range, and I know that our trust, of course, embraces community as well as mental, and so along with the whole issues of the consolidation we've gone through, that, but there is the desire to kind of spread that out. But it struck me, you're probably now working with a number of, and with the acute trusts, university hospital trusts, which suggests to me that that's also a potential route that you could use to subvert, to say, can we get in somehow on the teaching side of the university? Because of course they are involved in the teaching. That's part of what's in the name, isn't it? Well, is that what you plan to do?
Hello, Andy. Thank you so much for those insightful points. I entirely agree about the training around confidentiality, and it is a hot topic, which is why we're so thrilled Donna will be taking that as our first webinar in April. So please be in touch if that's something that would interest you and you would like to know a little bit more about. And I couldn't agree more about you know, the art of listening, and certainly there are a number of very high profile national serious incident cases which demonstrate that had someone listened to what the carer was saying, you know, the outcomes may have been more preventable. In terms of working with some of the university trusts, yes, absolutely, and looking at that as an opportunity to take training forward, I think is an area that, you know, we hope to expand into. It's very early days, Andy, and but it's definitely on the forward plan. But it's nice in some ways to hear that that's something you're suggesting, because we've been thinking the same. So it sounds like we're on the right pathway there.
Thank you.
Thanks, Andy, and thanks so much, Debbie. We're out of time, unfortunately. I do not know where that hour's gone. It has absolutely flown by. So thank you so much, Donna, and thanks, Debbie, for coming, and thanks to everyone for your engagement and contributions. I think that we certainly at NHS England really appreciate everyone keep showing up to these sessions and sharing learning insights like this. It's great. It's great to be part of. Thank you so much. And Steve, I'm sure will let us know when the next Lunch and Learn webinar is. We hope to see a lot of you there then, and take good care, everyone. Thank you.
Thank you.
Thank you.